the first one I just was going to ask is, I guess, less so about someone else doing massage, but like self massage techniques, whether it's like foam rolling or just manipulation of their hands, or like I was saying, like I know you do the ball series on the belly and hip flexors a lot. How, like, when do you determine when that could be useful for clients? Is there anything specific you're looking for that's like a tell that's like, okay, this is a like there's a high possibility or whatever that this could be useful for them?
Yeah. So I think like where we have to start with like something like a question like that is actually just looking at what do we think of like that massage is, and like what's the value there generally, broadly, and then like that will help going into specific areas make more sense. And this has definitely changed for me over the years, where I originally looked at it as just sort of like a version of stretching, or an extension of the idea of stretching for more specific anatomy, right? So if you wanted to stretch a hip flexor, you'd put pressure on a hip flexor. That was sort of my original idea of like why I would do this kind of stuff. And then there wouldn't be much separation between the idea of like foam rolling, which is just creating deep pressure and maybe like a shear force, versus something where you'd put like just deep pressure and have someone lie on it and then be able to move around that pressure. But I've tried to or over time I've seen like more of a process there that has to be, it takes into consideration more things. So the way I look at any type of like pressure work is that there's sort of like 4 parts to it that you need to be able to go through, which then just improves any mobility process. But then it can be very specific when people need specificity. So and the reasons that people would need specificity are not so much like specific anatomy, but they need a lot of specificity of not compensating, right? They're just not really good at being able to like maintain a position in one area and dissociate movement in another area. So hold on one second. Someone's calling me, and let me get that clear. I thought I had turned it off, but I did not. All right, that should be done. Yeah, but so if there is a point where there's just there's just a hard time for people to actually understand how to move from one joint and not move from a nearby joint, right? So I think that's a good place, to start working on that. Or if somebody's just got a hard time, like understanding, like where you're asking them to move from, but also maybe breath work. So especially when you're going after the abdomen, like someone's just having a hard time understanding like the subtle movements that you're asking them to do, you could just put pressure in that area, and then that becomes feedback for where you want them to create motion. All right. So if I were to break down what I'm looking for there, or like how the process that I'm trying to go through with clients, I want them to first be able to desensitize to pressure, because that has its own value right there, right? So if you are somebody who like can lie on a firm ball on the ground, right, or like even a kettlebell handle, let's like use the more aggressive things that aren't really necessary, in my opinion. Like you don't really need to go there, but let's just say you can. And you can go there and you can have like a metal pressure in your belly with maintaining breath control, still being able to, like move around actually and explore that pressure to deeper parts of your body. That tells you that you're likely in a better situation to create change than someone who, as soon as like a softball touches their body, they clam up, they guard, they can't relax into that pressure, right? So there's a value to just being less sensitive to pressure, because now you can allow that pressure to get deeper into your body, and then that depth allows you to explore deeper anatomy. And I don't think it's very specific anatomy, because that's just not the way that the layering of our body works, right? Like, so to say that you're going in the abdomen and you're going after a psoas or going after an iliacus specifically, I think is, you're overstating things. But you can know the anatomy is there, and you can know that maybe you're having more of an effect on what that anatomy has an effect on, right? Possibly, right? So if you want to move a pelvis or create motion in a pelvis, right? Like you have to be able to go deeper. You can't just be messing with stuff on the surface, right? So if somebody can't tolerate pressure, they can't tolerate depth then. They can't tolerate anything kind of getting deeper, and then you can't create any type of motion or change through there. The other piece of desensitization is if you can't tolerate the pressure, then you can't breathe there, right? So the breath will be guarded. Guarded tends to be closer to hyperventilation or just breath holding in a manner that is like, make this stop, right? It's protective. So just by allowing someone to desensitize, you've already taught them how to relax their nervous system. Like you've given them a strategy for, nervous system relaxation. And then it makes sense to me just based on like where certain anatomy is, and just like the way that like protective mechanisms like would work in the body, that there's certain places that would get people to relax their nervous system in a broader fashion, right? So you go after the abdomen. Now it might be the most sensitive thing because the organs are there. But if you do it well, just like you would increase someone's weight, like start light and progressive adaptation type of deal, and somebody gets used to the fact that like, oh, okay, like I'm not going to damage my viscera by putting pressure in my belly, and that becomes the norm, and that becomes like a process for them that they can explore. Well, that's a powerful strategy for nervous system relaxation, right? Because they're teaching an area that would normally be, if not taught, very protective, to be less protective, right? And to me, that is like kind of a foundation of how you want to go from relaxation to like that sympathetic fight or flight, which is all about protection. Right. So the other area would be then the upper back, the thoracic region, because that's basically where the sympathetic nervous system is housed, like on the anterior part of the spine. So that area tends to be really sensitive for people. And I've had people in the past, especially people that are, a bit older and have like a more fixed kyphotic thoracic spine. If you put too much pressure in the thoracic spine too soon, it's an absolute like sympathetic response, nausea, dizziness, things like that can happen. So there's a lot of connection there to the nervous system. With that being said, like you got to be careful, but if you can get people progressively more tolerant to pressure in that area, you're teaching them a strategy to desensitize things. And when pain is an issue, like that's huge. It's not specific though. It's just huge though to be able to say like, all right, I have this strategy that I can do reliably, and you've seen progress with it. Like you've seen people not be able to tolerate like a massage ball in any other manner, but maybe against the wall sitting, and then all of a sudden they can lie on their back on initially maybe a soft surface, and then eventually a firmer surface, right? And then it's just a matter of like, is it useful to go any farther than that? But there is a process of progression, just like anything else we do in strength and conditioning, to getting somebody used to more pressure. And we have to, I think, where misconceptions come along is there's a lot of like marketing towards like, okay, make it hurt, and then that's the value. I look at it as if you can tolerate the hurt and then you're probably in a better state than someone who body can't tolerate that. But there's a process to get there, and there's also like, what is the hurt doing for you at the time? Are you just like enduring it, or are you really like, is it actually not that bad to have a firmer thing going into you because your body has become desensitized to it, but you're also aware of how to let your body relax even in the face of firm pressure. So there's a big difference between like being a tough guy who's just like gritting their teeth and tolerating and looking for more pressure, but you're not like learning anything there. You're just upping your protective response, and you just might have like a tougher protective response, but there's not an allowing of the pressure to actually deepen and do anything. So like the first step would be desensitization, but that immediately connects to the second step, which would be to deepen the pressure, right? So you can think of these as all D words too, right? Desensitize, deepen, right? So once you tolerate more, now you can allow that pressure to sink in a little bit deeper. And then once it can sink in a little bit deeper, well, now you're gaining more proprioception and awareness to areas that often you cannot see, right? Or we don't even think of, right? So like the back of our body, we can never see it, right? But how do we know it's there? Proprioception, right? But if you get more contact and more specific contact that you're not trying to guard yourself away from, but you're actually allowing your body to deepen into, well, now you get more of an appreciation for the separation of like, where's the scapula, where's the dorsal rostral area, like where's the spine start, right? Like depending on the different type of implements you're using, whether it's the ball and, like that's, I think, a big piece of it is you actually start to develop a better awareness of your own anatomy because you're not in a fight or flight state. You're actually just, now you can allow the pressure to deepen. Now you're in like a curiosity state. And then you're seeking out and you're exploring. And I think that just has like a ton of value for people because they're more in control. You've just given them the opportunity to have that type of control. And then it's almost like show them like the anatomy, give them some like guidelines for it, but then have them seek out things that they feel that are now deeper. And again, certain areas, that's why I go for the abdomen so often, because I just think there's a lot to discover there for people, right? They can discover feelings of like indigestion. They can discover just a lot of like not wanting to let go. And then the actual feeling of letting go, it could be, the contrast could be very stark for people. It's very powerful for just getting people to like breathe lower, right? Like, and a lot of people need to be able to do that. It can be very valuable for, put people on their side for that lateral rib cage, bucket handle breathing, because like that's a difficult thing until you create actual pressure in the area you want them to breathe. That's not so aggressive that they're not, in a biting their tongue position because they're in so much discomfort. But when they can actually relax into it and you give them a soft enough implement that they can do that, it's just so much feedback that they wouldn't get any other way.
Yeah.
And, the thing that you see is that right after that, people tend to feel better. They feel different. They understand what you were asking them to do, but it doesn't stick, right? Like, and which is interesting because it's not meant to be like a structural stick, right? Like where, oh, you're actually, like changing the physiological structure or like the length of a tissue. To me, it's more just like you felt that, right? Like that awareness of how to do something, even that doesn't stick because the body's like, especially around the breath, like it is always changing depending on your emotional state, what you just did, and just how much practice you have over time. But that gets the process started of saying like, at least you know what I'm talking about sometimes, right?
Yeah.
And then you have that as a strategy when you're noticing that you can't do it in any other way, right? You can go to something like that. So once you like desensitize, once you allow that pressure to deepen, well, now you can dissociate one action from another, which is what basically the idea of breathing low into the pressure of the ball versus breathing up into the neck or into the accessory muscles is. It's just dissociating away from common compensations. And I think that's super valuable. Like that's most of the time what we're trying to do in our corrective movement interventions. We're just trying to teach people like what their normal compensations are and how we would like them to move. And it's a really difficult thing to do because it's the thing that their body just really doesn't want to do, right? So it's like you really have to teach people to slow down when you do that, right? Or you have to give them passive blocks, like so that like they're in such a position of either stretch or end range that they can't move at all. So the only movement direction that they can make would be away from their compensation and towards what you want. If you're moving too much, most of the time you're not really improving like end range mobility, like mobility where you actually need it, because you wouldn't be able to move a lot if it was actually close to your restrictions, right? But
Yeah.
that's the hard part for an individual, is to say, like, I'm asking you to do an exercise, but I really don't want you to move, right? Because the idea of thinking about exercise would be that, like, okay, this is going to be like a bunch of reps of something that you can do that you just haven't been doing. But really, if you're looking at mobility, you're trying to block certain areas that are moving too much and create motion in an area that they don't really have motion yet.
Mm-hmm.
So that's a hard thing to do, and that's to me where manual therapy and these, self massage techniques, or I like to think of them and rebrand them as pressure therapy techniques, where you're just like,
Mm-hmm.
basically, you're manipulating pressure, you're allowing that pressure to deepen, and then you're able to have people feel one area either be held in place by that pressure implement while you're trying to move a joint around it.
Mm-hmm.
And so that would be like the three parts there of like that you're looking for anybody who's just having a hard time without that pressure implement dissociating joint motion. Does that
Mm-hmm.
make sense? So
Yeah.
in the abdomen, it's hip extension a lot of times is what I'm going after, but it can be a combination of hip extension and hip adduction and internal rotation. The key is that the pressure of a ball in the abdomen starts to prevent extension at the lumbar spine. And then depending on where you put that ball, it could be, more biased to lower lumbar. It could be more biased to upper lumbar. You can also connect that to, all right, well, if I'm upper, I might be higher psoas. If I'm lower, I might be more iliacus. But I don't think you need to make those separations. I think it's valuable to know your anatomy, but it's valuable to have several strategies in your anatomy knowledge too, right? Like if you're just going to, well, I'm just releasing the psoas when I'm doing this, and then somebody calls you out and shows you research that it's like you're probably not. Well, then you have to figure out, it's like that doesn't need to matter, because you're like, well, I'm still getting value. But
Yeah.
if you have like a really narrow theory, somebody can just destroy your theory really quick, and you may then not do something that was valuable just because you didn't have a broad enough understanding of what you might be accomplishing, right? And I
Right.
think that happens a lot in manual therapy. That happens a lot in exercise, especially rehab, when you're trying to connect global movement to like what is supposed to be specific structural change, which I don't really think happens or needs to happen that as often as people think it does. Where it's just like you can make change to somebody's pain and somebody's movement pretty quickly, but to say that you're changing structure, I mean, that's a jump there. Like I don't. It probably happens over time, but it's like we'll never know unless we are always moving people and changing people, like with some type of ultrasound or MRI technology happening at the same time. Like it's
Yeah.
always going to be a jump, and there's reasons that things change quickly without structural change. Like we know that's true. Like just nervous system changes come quickly, um, but it's all valuable. Like any change is valuable. Like the process that you're looking for, though, is that somebody just gets more tolerant to these type of interventions, so that they can go to that and they can like understand their deeper anatomy better on a more regular basis. Like I think that's a super valuable thing.
Mm-hmm.
And if you think about it that way, then you don't have to get lost in anybody's theories, right? Like it's
Yeah.
just like, okay, like I'm just trying to do like what therapy is to me is that it's a gradual process of getting people more tolerant to things, right? Like, and I think the more general you make that definition, the better, right? Because then so many things can fit into it, and then you don't again have to get lost in these specific structural theories that often are easily refuted because they're too specific, right? For a complex being. So when we think of it that way, then it starts to make more sense to implement these things into your treatment protocols for people. But you also have to have like a bigger idea of what you're trying to get from people, right?
Right.
So most of the time, you're just trying to give people movement options. So how would this give someone a movement option? Well, it would desensitize them to pressure, which gives them more of a positional option, right? Like if you can sit on a hard surface versus always needing to sit on a couch, well, that's improved tolerance to pressure, right? If you can be barefoot more frequently on hard surfaces, that's more tolerance to pressure. And again, it's not just like grit and bear it.
Yeah.
you've gone through the process, and it's literally like not that big a deal. And that
Right.
does happen, right? Right? Like you've likely experienced that, and I've certainly experienced that. That's what I would be trying to get out of my clients, is just a gradual process of them finding that, like, that
Yeah.
difference. And you definitely can't force it with people. Like, I think it's bad advice to say, well, everybody should be barefoot, or everybody, like, you should never sit on a couch, like, because you try to change people too quickly, you will make them worse
Yeah.
every time, bad too. And I've gone too fast with people,
Yeah.
definitely. And over the course of just growing up as a professional, like, as you're exploring things in your own practice, and you're younger, right, when you're doing this, you think because you've seen a change in your body that everybody should be doing what you're doing and being at the same speed that you're at. It's rare that when you make like an initial change in yourself that you see the process, you just see the result. So
Right.
you're like, well, I got here by not wearing shoes as much, so no one should wear shoes. Instead of looking at it as like, what's the underlying process here? Well, I've desensitized to something. The first step was like just getting your mind wrapped around that, like, you have to think outside the box sometimes.
Right.
But then it's about like a process, and like what's somebody willing to risk, right? Like, when you're changing, you're willing to risk that you might be a little worse for a second, or that you'll at least be uncomfortable, because you're taking a step towards change. Well, we have to change people, like, that's our job, right? And that's a difficult thing, but we're responsible for not, like, hurting people too, right? Which is a slippery slope, because when you're trying to ask someone to, like, change their behaviors, change their thought process towards movement, and just do something that they haven't done before, like, you're really putting someone in a situation where it would make sense that they felt worse. So if you have a process that is very, very, like, gradual, that's the best way you can hopefully change someone, but not make them worse in that process, and make them feel like they're in control of that change too, which I think is really valuable. And I've seen this pressure therapy stuff be that for a lot of people, where it's just, you can give them so many options. You can give them different pressures of balls. You can give them different positions to be in, but it's just this onset of start to change the feeling in that area, right? And you're in control of it. Like, I'm not even putting my hands on you. You can, massage that out. You let me know, does that feel good, or does that not feel good? Like, we can find different ways maybe to make that feel better for you, right? If it's threatening to someone right off the bat, you got to change it, right? But maybe what that initiation of them feeling that it's uncomfortable and it's threatening to them, like the first session, that now becomes your assessment to say, like, I'd like to get them to feel that that's not threatening at some point. And then it's just like any other therapeutic process, like, that could be a goal of seeing, like, if they are able to tolerate pressure in their thoracic spine in a supine position on a decently firm surface, where on day one they can only do it sitting against a wall, a padded wall or something like that, you've demonstrated progress for that person.
Right.
And then you can eventually add to that. It's like, okay, now can you inhale into the ball in your thoracic spine, which now creates dorsal rostral expansion type motion. Like, real subtle stuff with breathing can start to be felt, but it can't be felt without that desensitization. Like, ask someone the first time you put a ball in the thoracic spine to try to breathe into their upper back, and they're like, what do you like, they're just trying to tolerate the pressure, right? So it has to be a gradual process. But to me, it's one of the most specific processes that can eventually occur for asking people to move into these specific anatomical regions, which is what is necessary to create the idea of relative motion.
Yeah. Yeah, that makes sense. It's almost like it just seems like duration is so important for all of it, because it's like, at first someone's probably going to find it, at least, like, even maybe the most gradual, somewhat threatening, but it's like after you spend a few minutes there, you kind of have to relax. But
that's the fourth D.
Yeah. Oh, okay.
Duration. And I like using duration for a couple of reasons. Like, broadly, what you just said is perfect. You need time to see how your body adapts and reacts. And I connect that idea to McKenzie physical therapy in a weird way, I think, because it's not exactly similar, but like a lot of what McKenzie is basically just repeated motion testing. And if you just did one motion, you wouldn't get any of the information. Like there wouldn't be a McKenzie if there was just one motion. So you need repeated motions, which means you need more duration of that motion to actually assess what's going on with this person and to categorize them and then to get the results that actually are pretty well studied. And I think it's very simple, and that's why like people that have more of a deeper anatomical understanding will sort of poo-poo that, because it's just, well, it's like not deep enough from a movement model, but it gives results that are well studied. And I think one of the values of it is this: it uses this idea of repeated motion to broadly categorize, and if you can put somebody in a broad category, you know exactly what to do with them, and then it works. And then that's also something that can be studied pretty easily. But that's something that you see like pretty commonly that in McKenzie, that there's actually like part of the categorization is, does somebody hurt with their initial movement, or does pain get better with more movement, or does it get worse with more movement? Well, that's the same thing if you're just putting static pressure on something. Does it get worse after 2 minutes, or does it get better after 2 minutes? So frequently it gets better. But it doesn't get better if you're not careful with what you're doing as a therapist. And it's not that it actually gets worse. What'll happen, and this has happened to me, and it's just like you have to use that as, okay, I gotta make something easier. People just won't stay there for 2 minutes. Like they just physically can't tolerate it, or they're just like, no, you know what I mean? Like they get off. They're like, are you crazy? You know, something along those lines. So that tells me that, all right, they can't actually spend the 2 minutes there. So that's several ways you can use duration with this. Is like the goal would be 2 minutes, but you can't get there yet. Like, what is your current duration? And 2 minutes is kind of arbitrary. I think there's a little bit of evidence science behind it, but that's just what I use. 90 seconds sometimes. I remember 90 seconds being like the. Did you ever hear of strain counter strain? So that's a manual therapy technique that it's just like you kind of reposition a joint, and then you just like maintain the position for 90 seconds, and it's supposed to inhibit, you know, the joint. And then for like GTO firing and some mechanoreceptor stuff, like that's what I remember learning, but I don't know, you know, where that's, how deep that's backed by like science, but you can explore with different people. I would just say it's nice to have like a standard that you're saying, like, can you make 2 minutes here? Because if you can, then most likely this is going to be something that, you know, you can do and you can get better with. If you can't quite make 2 minutes there, well, maybe that's just the first goal, that we do like little interval training for you to get you closer to just spending 2 minutes with that pressure. And then that's just part of your desensitization process. But that's important, like that you're thinking about duration. Like 10 seconds is not going to do much no matter what. But if it's 10 seconds followed by another 10 seconds, maybe that's your start, right? Like just to get people used to it. Like there can be some value there, but it's not going to be like, it's nowhere near your end game, basically. It's just to get you farther along the duration scale.
And like weirdly kind of connecting it to, like, I just think kind of connecting it to Bill's stuff weirdly, because I guess I try to do that with everything, but like just I think about, like, he talks a lot about breath holding and how that's just like a compressive strategy, and it's like if you're trying to create motion somewhere, you can't really be holding your breath, and that's why I guess duration, that's one possible reason why duration could be so valuable, is that it's like if you have to spend that much time there, you have to be able to breathe, which you always talk about. But
yeah, and I would say it depends on how you're holding your breath, right? So breath holding is one of these things I think that gets a bad rap, but it's all about intention, right? Because I think if you look at the breath and what's like the ultimate goal that you're trying to move away from is hyperventilation, right? And breath holding can actually limit hyperventilation but it has to be controlled. And I don't think that broadly holding your breath is a compressive strategy. I think it can be, but
Yep.
if, for instance, if you are taking an inhale, directing it where you would want to direct it, say you're like filling the glass from the bottom up. You're starting to inhale, you're opening up all of your upper airway, and then you're dropping the diaphragm down, and now you're starting to get some bucket handle, pump handle movement, and then you just hold it. You retain
Yeah.
after the inhale. Well, that's not that different than like an isometric expansion, right? So if you need expansion, that's actually helpful. And then to get better at that hold without relative losing of
Yep.
that strategy, right? But that's something that I think is pretty easy to train and feel. And it can be a very valuable thing to just have people be aware of like what you mean by expansion, right? So the Valsalva maneuver now is sort of you go into expansion, and some people don't, right? Like if you don't teach someone to like expand first on an inhale, and they'll just Valsalva, and then that's a compressive strategy without any pre-expansion strategy, right? But say you're going in deadlift, you breathe into the belt, you really fill up, and then there's a natural Valsalva from that expanded position when the weight gets heaviest.
Yep.
You're still relatively expanded than your resting position, right? Which actually can be, there's a lot of pressure there that can be very strength producing,
Right.
and that's typically where I think it's agreed upon where people are the strongest with a breath hold. But it's a relative compression strategy, but it really depends on how big you expanded first.
Yeah.
Right. And if you are just like at rest and you're, just doing some breath work and you inhale and expand and you hold that expansion, but you're really not actually like closing the glottis. You're not just moving towards any type of exhalation yet. Well, now you're just basically getting a little bit more out of that expansion, in my opinion.
Yep.
You can explore it. You can kind of look at it, and that's part of many breath strategies. So, like a 4-7-8, there's the 7 is holding the expansion and just seeing what it feels like and seeing where it is. And in that hold, sometimes you can actually readjust. Okay, like it doesn't feel as in my upper back as I'd like, so I can maybe create a little bit of motion there. So I think that's super valuable. But again, it's not. Who are you talking to? Are you talking to the person that's holding their breath during and everything is about weight training? Or is it somebody who's doing breath work like pranayamas and yoga? That's a different story. And it's amazing when you start manipulating the breath, how much you can do with these areas of creating expansion just by sitting on your ass, right? Just by going through breathing and like holding and exploring, because you got to get really internal with that stuff and you have to get really subtle. And you do that for like 20 minutes where you're just working on breath, then go in and retest your movement, things will change.
Yeah.
And then, or just maybe retest your movement, then connect it to something that also adds the direction of joint motion that you're looking for. It'll just be so much easier to get what you're looking for versus if you just tried to do like 2 minutes and trying to really get aggressive with your expansion into an area. It's a lot harder.
Right. That makes sense.
And that's why I think yoga can be so valuable. It's just it doesn't really mean anything anymore, right? It means completely different things to different people, and it's really people think of it as stretching, but ultimately, like if you just work on some of the breath techniques that are in yoga, and then you put them into the asanas, which are the static positions, and connect, or the vinyasas, which are the flow. I mean, and it becomes about the breath. You do that for like an hour, everything feels better, right?
Yeah.
It really does. And if you have some other practice for mobility, you'll usually get more out of it after doing yoga. The problem with that is it's just a lot of time. It's so much. It's time consuming. So I think it's important to be able to find like the commonalities in all of those movement practices. But the idea of using the breath to create more motion isn't new. I think we have a lot more understanding of like terminology that makes sense in our anatomical culture, right? Because like a lot of yogic stuff it's its own terminology from another time.
Yeah, makes sense. like the 478 to me kind of seems like a desensitization almost in itself. It's like if people are typically breathing just up in their neck and like I feel like it just sort of gets you away from that because you can't really sustain it if you're just like
It's harder,
breathing.
yeah. It's hard, and
So,
especially that longer exhale is really hard for people when they aren't moving things low with the inhale.
mhm.
You can breathe in and hold for 7, no problem, up in your neck.
Yeah,
You know what I mean? You see people
yeah,
do that all the time. It's then when you actually have to let that out slowly for 8, you don't. It's like there's nowhere for it to go, because that's one of the problems with accessory breathing. It's not built for a long exhalation. It's not built for a slow breath. That
right.
is built for more hyperventilation. And hyperventilation, it seems like it would create more oxygenation in the body, but it does the opposite. It creates constriction in the body. So like and this is this weird process. Like, I'm a former asthmatic, or maybe still an asthmatic, but you haven't had an asthma attack in quite a while. What the process was always, I would get some feeling where I couldn't breathe, and then I would try to breathe more, and it would just make it so much worse. And,
Hmm.
and the best thing to do, and like when you know you're kind of getting out of an asthma attack, the first thing that it feels like is like, oh, you can actually breathe out longer, right? And if you don't have any education about that, which I didn't as a young kid, it was just, I finally don't have to keep going this way.
Yeah.
And then like the exhale would often feel like a wheeze too, but everything was all ramped up. If everything felt rapid. So imagine trying to slow the whole process down, which feels like it's very much against what threat does to your body, right? But slowing the process down allows for, an exhale to take hold longer. But if we're going into this kind of breathing that's sort of built for speeding everything up, we won't be able to do that. So that longer exhale stuff is like the first place I think you want to go with people, just to see, can they do it, and
Hmm.
then to gradually train that. And the 478 is just one way of doing that. Box breathing is another way
Yep.
to do that. And I also find it just valuable to introduce people that are not in the field to the different terminologies behind the breath, because people breathe all the time. They probably heard about inhaling and exhaling, but I think I take that for granted too much, that somebody knows what I'm talking about when I say inhale and exhale. So sometimes I have to like say breathe in, breathe out, and then that could get really confusing, because when you want someone to breathe in, you want their body to move out, right? You want their body to expand. So there's like this opposite terminology of what you want your body to
Yeah.
do. And like until you get the person in front of you, you don't know how you're going to have to manipulate your language to to fit where
Yeah.
they are. And it's just, you can't take anything for granted, I think, when it comes to a client, just because they're not educated on any of this stuff. So that
Hmm.
takes time to just see where they are with the language that you use. And sometimes the best thing to do is just have them feel something and like talk less, right? It's just slowly breathe in. And that's where manual therapy again comes in really nicely. It's a guide
Yep.
more than it is like a specific attempt at changing tissue. It's just a guide to get them to do something that like they just won't be able to do without that manual contact and direction.
Hmm. Is is needling, like, would you look at needling to a certain extent as it's just a way to move deeper into a tissue to, like, in
Yeah.
some way?
I mean, it's you broadly, you definitely be able to fit it into the idea of pressure manipulation or pressure
Yeah.
therapy. I don't know that it's always used that way, but
Yeah.
I mean, if you've ever had needling, I've had needling. It's very effective. It's very
Hmm.
specific, which is cool.
Yeah.
Um, but it also matters like your tolerance to it. Like
Right.
how are you resting on the table when someone's putting needles in you? Are you like immediately screaming in pain every time that happens? Which I've seen that happen. I don't needle myself, but I have good friends that do, and they do a lot of it. And there's just in my experience with getting needling and in watching some other people get needling, that the effect is going to be a lot different when somebody is like feeling the needle going in and not having their body respond with like a
Yeah.
tightening up or a jumping versus someone who's like literally screaming in pain every time it happens. Like
Yeah.
it's going to be a different response. So you
Yeah.
have to take that into account. Now, you also think if you get multiple sessions of needling, it's probably going to, there'll be less of that response, you would
Yeah.
think. Now, I know with manual therapy, that doesn't always happen because it's almost, unless you're educating your client on it, there's almost this thought of like, that's what I'm supposed to do. I'm supposed to take this pain, so I'm supposed to yell in pain because that means like it's working.
Yeah.
And you have to educate people around that, but sometimes that education doesn't work. And then I often have to make decisions whether am I really helping this person because this is just their response. They might want it. They might ask for like that deep pressure work, but they can't respond in any other way but like screaming in pain.
Yeah.
You know what I mean? It's like I don't feel like they're not fitting into my therapeutic process at that point. But maybe it's just something that if they feel somewhat better with it, that fits into the kind of psychosocial model there, and that's fine as long as they're not hurting themselves. Right?
Right.
But I would be testing afterwards to see, do you feel like you can move better? Do you feel like you're in less pain? And if
Yeah.
they say yes, then you keep doing it. But it wouldn't be part of my hands-on approach, I would say, but it might be still, I'd give them the opportunity to do that from like a self foam rolling standpoint
Mm-hmm.
if they feel like it's valuable. But
Mm-hmm.
I'm definitely trying to educate on what I'm telling you right now, but I'm doing it more to a layperson, right, than someone
Mm-hmm.
who's like looking to study this stuff. Because I
Yeah.
think that's important to get the idea of. Because I've had people that I've been working with for years that they'll finally kind of say back to me what I've been trying to say for years, and it's a cool thing, but it's also interesting because most physical therapy clients you won't see for that long, right? You'll see for 6 months, and you don't realize how long sometimes it takes for someone to feel what you're trying to get them to feel and appreciate what you're trying to get them to appreciate. So when that happens, it's sort of like, okay, you just need to be patient sometimes, and you need to just kind of keep reminding people, like, the goal is not to make yourself hurt. The goal
Yeah.
is to try to get more tolerant to this. The goal is to try to breathe here. And then when somebody like actually feels more relaxed after they're done for the first time, and they're just like, wow, like this is actually relaxing, which is bizarre because I always thought it was supposed to hurt. And you're like, all right, good. You don't
All right.
have to say I told you so. Just like, okay, that's the idea,
Mm-hmm.
right? But I find that those things very valuable. Just those interventions, I guess, that are in that broad category.
Mm-hmm.
We've talked about the feet, and like using a ball for the feet, I think creates a lot of the motion that is very subtle, and there's all these different joints in the feet that have to sort of move in different directions, and that's a really hard ask of people without some type of pressure, directed pressure. So manual therapy works for that, but I think balls that have give to them, like pinky balls or the tune-up balls that eventually you break down, they really can help you guide foot pressure pretty well. So totally valuable, but it goes through the same process. If it's too sensitive to have a ball touching your foot, you have to first desensitize before you really ask anybody to create specific motion there.
Yeah. Right. Makes sense. Yeah. I probably only have time for like one or two more, if that's okay, because I got to run at 11. But I guess going more towards the manual side, do you ever refer out for people to get massages? Like, do you see that as a useful thing? Because I guess, again, like, I'm thinking of duration and how it can just be helpful, especially in terms of people with like a high um, superficial sort of strategy of their muscles and are like, I mean, quote unquote tight, but just like very superficially driven on things. Like, do you see massage as being a useful method for that?
Yeah, I mean, the way I like to think about it is I don't like to refer people out for services. I like to refer people out to other professionals that I think are really good.
Mm-hmm.
And they might just happen to have a business model that is guided towards like a specific service.
Okay.
And I think that's definitely changed over the years, because people will come asking for the service, but it's night and day depending on the person that's giving it. And I don't think of it as just because they might be good with their hands, but a lot of it has to do with just how are they going to connect to people? How versatile are they at connecting to different personalities? So you're going to know your client well, and you're going to know what they need and what they don't need. And everybody's kind of got a different way of being, and I just think that you just need to know the professional, but you also, it's good that they are kind of marketed as a massage therapist, because that's what people are going to ask for,
Right.
right? So I refer out all the time, but it's to people that I really trust,
Right.
because they're just good professionals. Like they know how to talk to people. They know how to put people in a state that would like totally relax them. They may have different theories in the way they talk about than I do, but that's what someone needs at that time. And then the other piece is like, you can't do it all, right? So like, if you're a physical therapist, well, you can be a manual therapist, you can massage people, you can learn about all that stuff, but your setup is never going to be the same as someone that just does that, or just has a situation where you come in and they're just working only with their hands. So those people are going to be better with their hands than me. I may have a different model of how I use my hands and why I use my hands, but they're just going to have like smarter fingers. Is the way I like to think about it, because they just do it all the time, and it's going to be a different experience for the patient or client. So yes, like I think it's important to refer that out, but you really got to be sure that you're referring out to someone that's not just good with their tool, but good with their ability to talk to somebody. And I just think that that's huge, and won't contradict you, but doesn't need to say the same thing you say. Like, so I rarely do people say the same thing I say, and it's not because like I say anything special. It's just like we all come from a different background. We've all taken different like continuing ed work, and especially when you're going into different scopes of practice, that's just, it ends up coming down to the same stuff that's being done physically, but the reasoning behind it in your own head is going to be different. And I look for people that just aren't too forceful and saying like, this is what's happening. Like, I think that's important, because then it's like hard to backtrack from that and say something different without like feeling like you're ripping apart the opinion of someone else. So someone who's very open-minded, to me, is really helpful, and someone who can really like toe the line with, depending on the personality they're dealing with, is really important.
Makes sense. Yeah, it's like I feel like people are just always like, I need this or this. And it's like, okay, well, I know the person.
Yeah, and it's good to have a person that's good at it, and has a good reputation. And so I have different people that do different skills, like ART, dry needling, craniosacral, like all this different stuff. But I also am thinking, it's like, okay, what kind of personality does this person need right now, right? So like ART, I'll think of that as stuff that's like quick mobility, very specific mobility, and mobility in a loose way. Like, I want someone to feel a change in their mobility, and they will most likely.
Yeah.
And then I hope that feeling of change can then help our process by saying like, all right, what did, it's usually Dr. Tancredi. What did Dr. Tancredi work on that you felt value with? Because I'm pretty sure you'll find some value, or he's really good at like screening like who won't find value. So that's what I like trust about him. But if there is value found, then it's like, that's something that I can ride the coattails of, so to say, and be like, okay, what movements can we do that are similar than where you find value, so that you can, in between your sessions with him, be taking advantage of that. And it's similar with needling, I find. But like I'll refer to JJ Thomas, who's like very good friend of mine, and we speak a similar language, and she can often add the movement stuff right with that. So it's just great to kind of put people in her hands. But it's very helpful to just know that like we're kind of speaking a similar language there. And then from a movement perspective, I'll be like, well, what did you find the most value with the needling, and then we can maybe hone in on that.
Mm-hmm.
But when it's somebody who really needs like a lot of parasympathetic stuff, like most likely I'm not going to go referral ART or referral needling, right?
Yep.
It might be like got a great guy that does craniosacral. But he does so much more than that, and just the environment is more calm, like immediately. So I got like a couple people that I'll think, okay, parasympathetic. So got a dude that does traditional Chinese medicine, Kyle, and he's fantastic. And then also Andrew Abramson, who does just a bunch of different bodywork stuff. That's just fantastic. But it's just like the environment there is just so calming and parasympathetic. And I know that both of them are going to be able to talk to people in a way that just sort of meets their needs.
Mm-hmm. Absolutely. Awesome.
Yeah, I think that's a good topic because I often gets misunderstood, and so or it's just not thought of deep enough. And I think you can really go in depth about it.
Yeah,
you can help people.
Well, I know I'm guilty of not thinking deep enough of it. So this is been very helpful.
Well, and I guess we could part with this because I know how deep you are into PRI stuff and Bill Hartman stuff. So it's just you can use a lot of that to get what you're trying to get out of that stuff, and I find more value in adding an implement oftentimes into into those models, right? So if I'm trying to create a hip shift, well, I might put my hip on a ball and create a hip shift, and I just feel like I'm now getting some contact more centrally at the pelvis. You know what I mean? And there's just trying to figure out how do I take these movements that I'm trying to practice with the breath and with expansion and compression, but I actually add an implement that might be able to assist my expansion or compression. It can be super valuable. And that's, you can add in like the intermittent compression stuff with bands and stuff like that. That all fits in there too. It just is a way to enhance the model. And I find more value oftentimes in those interventions, but when you add the model to it, you get so much more out of it.
Yeah. Cool. Well, I'll start playing around with some stuff. Awesome.